Welcome to the No More Meds podcast with Dr. Corinne Weaver. Are you stressed out because you keep getting sick and don't know what steps to take? Are you sick of not getting answers from your doctor and always needing to take drugs? How would your life be different if you were healthy? Be inspired and stay tuned for some practical solutions for healthy living.
Well, hello, Mandy and Mike. I am so excited to have you guys on the No More Meds podcast show. And today we are going to talk about your kids. The main thing is, patients come to see me and they have either disabilities with their back or the neck, and they think chiropractic is just good for neck and back pain. Most of the time. But Mandy, you heard about me because of a friend. I believe it was one of your friends. You had your kids and they were all sick, and this was in 2016-ish. So you want to tell us about that story?
Yeah. So at the end of our fourth child was born November 11th, and she was about 6 weeks old, and the other three, I have three boys and a little girl. The three other ones, they all were sick. Of course, they gave it to Ella, who was 6 weeks old, and it ended up being an upper respiratory infection. And it got so bad, we had to go to the lung doctor. I can't remember his name, whatever his name is, but we had to go there. And he put all four children, including Ella, who was 6 weeks old, on breathing treatments, steroids, saline solution, I believe it was, and antibiotics or something, all on the nebulizer. So all four kids are doing breathing treatments like 4 times a day, I believe it was. And I'm nursing Ella, and I look down and I'm having to give her a breathing treatment while I'm nursing her. And I said, we talked about it. I said, there's got to be a better way. There's got to be something better than sitting here pumping this little 6-week-old baby girl full of steroids and medication. So I chatted with a friend. She had talked to me a little bit about it, but I had deaf ears. I was like, no, I don't believe in that stuff. It's weird. It's a joke. It doesn't work. She's like, okay, She's very patient. And at that time, when I said, there's got to be a better way. And I was like, okay, well, we're going to give this a try. What does it hurt at this point?
Yeah. And I remember actually meeting you, bringing your little baby in, and I have another family I can remember. I've been in practice for 16 years, and it was the same situation. She had 6 kids and they were all sick, and she brought the baby in with ear infections, and she was like, I'm done. It's like, what point do you have to do? You keep going to your pediatrician, you keep getting medications, you're doing the right thing, everything that you're taught to do as a parent. And you don't even think about chiropractic. My parents, they didn't think about chiropractic as well when I was on breathing treatments. And then you guys know my story. I was on breathing treatments twice a day, back and forth to the hospitals, and my parents didn't know any different. And so my mission, my goal is to get parents like you to get the understanding, the knowledge, because people don't realize that we go to 8 years of school too. You're like, oh, that's chiropractic. You go like a weekend school. I get that still sometimes. And it's like, no, not quite. We went to like 8 years of school and training. But you don't realize the nervous system and how powerful that nervous system is when your body's able to communicate to the brain, and specifically for your lungs. And so when I got my first adjustment, that's when I was able to realize, wow, chiropractic doesn't help just neck pain and back pain like majority of people know. It helps you to breathe better. And so I was able to get off my medication, off all my asthma, my breathing treatments, all of that. And I was like, wow, if I can get other parents to understand this, that's like my dream. So you guys are like my main mission, that you got that message from someone else. And now, since 2017 is when we've been working with the kids, and now it's 2020. And a lot's going on in 2020. Imagine if you didn't find me in 2017 and how the kids were being and what we're thinking about coronavirus and this respiratory disease that's going on now. What are you guys' thoughts are? What do you think, Mike? I know you were kind of skeptic of bringing the kids in, and you may not even really understand how it all works, but what's your perspective of, coming in, bringing the kids and seeing the change in their lives?
I saw a lot of the things that Mandy was seeing as well. And I always just remember we have this, I think we still have it, a large duffel bag, and it just just stuffed with vials and vials of that nebulizer treatment that she was just talking about. And she brought it up, and I think I said the same thing. I said, what does it hurt? I do have friends from high school. He's also a chiropractor, and so I didn't have one huge opinion one way or the other. But the biggest difference is, ever since we've been taking the kids, we just haven't gone to the specialists. We haven't gone to any of the lung doctors, and Ella does not have tubes in her ears. So all of those things and that we had to deal with in the past, we just don't have to deal with anymore. And it's kind of changed the way I'm looking at the health insurance, and what do we allocate and how do we budget our insurance. And it's much better at this point. I don't have any medical bills that are coming in that I have to allocate funds to. I mean, obviously we have to budget for chiropractic care, but it's more consistent, and we don't have the emergency huge bill that we have to deal with either. So obviously from my perspective, that's great.
Yeah.
And then of course the kids are much happier.
Yeah, money perspective for dad, because that's one thing is like I get is, for chiropractic, why does a kid need chiropractic? I'm like, because I saw 2 newborns just this week, Mandy. And why does a newborn need chiropractic? They're born into this world and they're supposed to be all healthy. But one of the kids couldn't poop. So the poop, it was constipated. It was 6 days. The mom was like so frustrated. She's done everything for this child, and the child cannot go to the bathroom. We did the adjustment within an hour. The baby poops. It's like, how does this work? Working with the nervous system, and all we do is really clear out. We look for that word subluxation. So we have a really cool scanner that the kids love. I don't know if do they love coming to see me? I mean, when they come in the office, they're so sweet. So I don't know what their perspective is going to see Dr. Weaver, but what would you say their experience is on coming to the office?
Honestly, they love coming to see you. If they even have a sniffle, if they even whatever, I want to go see Dr. Weaver. I want to go see Dr. Weaver. They love it. They actually beg to come see you for anything.
That's what I've noticed is that kids get it. Like they get when they don't feel well, and they understand that, something's not right in their bodies. I think they understand it more than we do as an adults, because we've had problems for a lot longer. But as soon as they fall or something happens, they come to see me because they feel like something's not right. And so we can look for that when I was talking about the subluxation, and we have that little scanner. We call it the little tickle machine. It goes up their neck, and then it shows the interference between the brain and the body. And so we're able to look to see if they need an adjustment. And if they need an adjustment, we clear it out and we recheck them. So it's a really neat, not just chiropractic, but we do upper cervical work, which is a little bit different. So the upper cervical component of it actually you can address by adjusting close to that vagus nerve. And so that vagus nerve is actually one that goes down to your diaphragm to help you with breathing. And so that's what I kind of understand the philosophy, not just that our bodies can heal themselves, but when there's a blockage with the nerves, and we're able to figure out how to clear that out, then the body can do what it's designed to do. And that's when, that's the very exciting part. So budging out is, one of those things is, once you get fixed, I guess, right? Or I'm like, okay, I'm fixed, my spine's fixed. Am I done? Well, are you still living and breathing? You probably still need chiropractic care, and so I think, you guys have been coming about once a month. Is that kind of your ritual, unless something happens? But I feel like once a month, especially for kids, because if you've seen any kid, they're going to fall or they got siblings. One of them's maybe hit by the other or something, so they kind of just need to get checked every once in a while. And that's what I love about chiropractic is that we're checking, the nervous system, and they only get adjusted when they need it. So how long did it take for you to get off the medications for the kids? Once you started coming to see me, do you remember?
It was, to my surprise, very quickly. Like I didn't expect the benefits of you and the upper cervical adjustment. I didn't expect it because I didn't believe in it, honestly. I didn't, and I was the first one to say I didn't believe in it at all. So
yeah, I think pretty much right after the first visit, that's when I started to not do the breathing treatments, because it was kind of reactionary anyway. If they started coughing and getting into the short of breath scenario, that's when all those medications and the nebulizers would be pulled out with all the tubes and everything. And pretty much after that, we didn't have to use it anymore, unless you said it was a good idea to do some other type of solution. But
Smart Silver.
Yeah,
Smart Silver.
Yeah, that's really good to know too. Smart Silver, and I don't know if we've ever used MSM before, but that's a nitro-inflammatory. Usually I would use silver first if it's an infection, and then if it's an inflammatory, we do what we call MSM, which works really well too. And then are you keeping up with some of the vitamins that we kind of suggested over the years? And which ones do you feel like that's been important for the kids and that they like?
yeah. Vitamin C, and then the vitamin D and the K12 droplets. I believe that's what it is. Those two. And then of course, if they get sick, we'll do, the probiotics, or I think that's it, probiotics.
Yeah, not too much.
Yeah, so not too many. You don't have a huge list of vitamins that you have to keep up with the kids. And that's what I found with chiropractic too, is like if you do chiropractic and you just turn on the nervous system, the body's going to do what it needs. And then just trying to get the best nutrition. Has your diet changed at all in the last couple of years? Just talking to you. I know you meet with my husband a lot at Costco. So
yes.
Yeah.
Well, pre-COVID, we were doing very well on our diet, making necessary changes with reduce sugar intake, and just getting the good stuff like you share with us, getting all the vitamins from our greens, and but now COVID's a different story.
Now that you've been kind of locked in the house with 4 kids. So you're probably going back to the things that make us feel really good. But definitely want to encourage you, now that almost, summer's here and winter's going to approach us again, to go back to the good, healthy eating, Mike.
Yes.
Yeah. Sugar is the biggest one, especially for anybody that has inflammatory and mucus. We tell people to try to limit sugar, get your sugar from fruits, other than other things. And we've been really into watermelon. If you hadn't got a watermelon at Costco yet, they're really good. So that's been our night treat, is like some kind of fresh watermelon. So if you want to do that,
eat a watermelon a day. We love them.
Yeah, watermelon is so great because not only is it have a lot of water, it's got a lot of fiber to it, so it helps clean out, and that's a good thing about getting those toxins out and help clean the body out. So, anything else that you guys would like to share about chiropractic and what you've learned through the office, and what other parents may be listening to right now to encourage them to bring their kids in to get them checked?
I would, if I could speak face to face with anybody who's listening, I would share with them that I walk in their shoes. I know exactly what they're feeling, what they're thinking as regards to chiropractic care. I would tell them, I promise it works. I have seen it for myself, come from unbelief to one of your biggest advocates, a cheerleader for you. I love you, and I love everything that you're doing. And like, even to see when friends have you ever had a child with an ear infection and you get an adjustment, and it seems like in minutes the drainage is coming from their nose and it's like instant relief, and you just would never think that would work. And then it's just repeated for 3 years. We have not went to the doctor at all, except for well visits. And we were almost late for those, just because we don't need to go, I guess, to get antibiotics for everything. You've taught us how to take care of our bodies. like you said, kick in the immune system, and it works. It's not instant gratification as antibiotics, if you will. A couple of days, what a 7-day regimen, you're better. Your body takes a little bit longer to heal at first, but every time you get sick, it takes less time. Like your body
your body gets stronger, your immune system gets stronger. And that's what I love about it is, when you have an infection or if you have a disease and you treat it with antibiotics, then it makes your immune system weaker, which we know. I mean, the microbiome is so important for our gut. And so if you don't do the antibiotics and you go through it a natural approach, then next time you get an infection, like you said, your immune system gets stronger. And you're not killing off the good bacteria. You got more bacteria, good healthy bacteria that can beat off the bad. So that's kind of the point that you were trying to get across, which is really neat to see that, and since you've been under care for 3 years with the kids, I've been doing this work for 16 years. So I have kids that I've seen since they were babies, since they're 16, and see just the changes that they've been able to, have full life really without needing any medication, majority of their life. I mean, a lot of people don't know, but my kids haven't had any medication. And so I have an 18-year-old he don't even know what drugs is, I'm sure he's heard about it now, but he doesn't know. We just don't have that in the medicine cabinet. Now, another thing that I'd like to talk about is essential oils. I think you've kind of really gotten to, were you using essential oils before you met me?
No, I think it was right at the beginning, the transition with coming to chiropractic care and oils at the same time.
Yeah, so you kind of crossed over, it's kind of funny. It's like when the people come in the chiropractic world, they kind of get into the essential oils and the vitamins. They're like, oh man, you're one of those people now, like oils can heal everything. But yeah, there's a lot of power in those essential oils. And I know I kind of train you, which a lot of people, they'll get into it and they have no idea what to do, what the dosing is, especially for kids. And so been able to really help you with, using the essentials. And now you feel like you probably, I don't know, I'm speaking for you, but do you feel like you have a little bit more power when something does come about that you kind of know what to do? I know you still send me texts every once in a while, and that's totally cool. But I love to see that you still feel like you have, some power and you're on, healing for them, what you've learned over the years.
Absolutely. They using oils, I was like, that's a joke. It's never going to work.
Right.
But then once we started, getting sick for various reasons, we would use oils, and now the kids love them. Like they ask for it when they have a little chest cold or their ears are hurting. We get the oils out, and it's just amazing. Just the benefits from it, just natural.
Yeah, the power of the plant. Yeah, go ahead, Mike.
Whenever they're going to bed and they have that cough, and we just do the nebulizer, and it's just kind of second nature right away. Not the nebulizer, the
diffuser.
The diffuser.
Yeah, that's a diffuser now, Mike. You don't need a nebulizer.
Yeah, right.
Sure.
But yeah, and then that seems to take care of it. Where in the past, I remember taking Asher to the emergency room for kind of one of those episodes of him coughing and heaving, and
like he was
sitting in the emergency room with him and all of that stuff. And now he starts, it's with a little bit of respiratory issue. We just
come get an adjustment.
Diffuser, get the adjustment, and he's fine.
Yeah,
that's been the greatest part. I remember sitting in the doctor's office, man, all constantly. It was every other couple of weekends. We'd be sitting in that waiting room with those kids.
Yeah. Yeah. And our oldest is 11. And then we have a 7-year-old and a 5-year-old. All of them have had tubes, numerous sets of tubes, 2, 3, and 4 sets of tubes on each. Ella has had 0 tubes, and it's because of you and your adjustments. And that's the only reason why Ella has not had tubes. And probably 30 rounds of antibiotic too. It's a little sarcastic, but I just want you to get the idea of how much antibiotic our kids used to take and
surgeries.
Yep.
Yeah.
And now
And yeah,
Nothing.
talking about the money, Mike. I mean, one ER visit, golly, you get that bill back. You're like, what? Yeah.
Yeah, at least we don't do like my parents. If there was an ear infection, they just let it go and burst over time. And
Oh no. That's my generation
like,
too.
no, Mom, we're not going to do that.
Yeah, we're not going to do that. You want to be responsible parents as best as you can. But now you have a lot of power. You feel like you probably have more power of what to do. You can always, you always have my cell phone to text me. Let's try to keep you as much as away from the hospital and the ER visits and keep them healthy. And that's what's really, really key, because there's a lot of things that are changing right now, as you guys know, with the COVID, and especially being respiratory, and you know how I feel about breathing. And if you have a child that has breathing issues, it is a very scary situation. I mean, when their oxygen levels go down and, and all of that. So, my parents, just like you guys, didn't have me really until I had to find chiropractic myself. But I was really feel like God led me to that, which is probably why you're in my office. I feel like every patient that comes in the office is either God led, and you're taking a step of faith, because it's hard. It's not an easy road to go on, because the majority of what's out there and what's being educated is take drugs, and this is the only way. Take the vaccinations. You have to do this and that, and it's like, well, what are we? What are we going to be, a bad parent if we don't do that? And so you're coming in and it's really about understanding the importance of the nervous system with chiropractic, and understanding the immune system. They work together. So getting that nervous system communication and getting the immune system well. I mean, we're still going to fight things. There's still going to be bugs. New bugs come out apparently every year. You're going to hear about a new virus, new bacteria. And it's all about, again, strengthening our immune system so we can be stronger. And you guys are doing the right thing. And I really encourage you to keep on your path and lean on to us. And that's why I wanted to get this podcast out there today. I feel like a lot of parents need to hear this. Is there anything else that you would like to share?
No, just thank you.
Yeah, thank you for everything. Thank you for the change in life, like during the flu season, if you will, or the cold season. You've completely changed our life, and we're very thankful for you and your dedication and your passion. And we just love you. We would recommend you to everybody, anybody, all the time. Just be patient. It does take a little bit of time to see the results, but then all of a sudden, you'll never look back and you'll be like, why did I not do this before? So I just highly encourage y'all to give her a shot, and you will love her.
Oh, thank you so much, Mandy. And I love that you keep bringing up the patience, because our bodies need patience. Just like if we were to work out today, do you think we'd be all buff, or do we want to lose 30 pounds in one night? Just not going to happen. Right. Yeah,
instant gratification there.
Right. Yeah. So our bodies, be patient with our bodies and take time. It took me a year. I think I was sick for with the asthma, it was about 11 years is where I was really, really, really sick with the asthma. And it took me a year to feel comfortable with throwing my inhaler away. And I remember that day, because I would have the inhaler in my pocket at all times, because you just never know when you can't breathe, when you have I had severe asthma. And so I would just have that pocket, in my pocket. And then I was able to throw about a year of chiropractic care and changing some of the ways that I was eating. And what I became allergic to was gluten. I didn't realize gluten and dairy was really high inflammatory for me till later on, but really chiropractic saved me. And then I just threw that inhaler away, and there was no going back, and I haven't been back since I think it was 21. I won't say my age. I go 41, 20 years now, 20 years with no inhaler. So that's amazing that your bodies can heal. And that's the biggest important thing is knowing that our bodies can heal and having that power within us. So I appreciate you guys coming on the show and taking the time to do this. You guys have a great day.
Thanks.
Thank you.
You too.
Thanks for listening to the No More Meds podcast. If you enjoyed this podcast, please share your favorite episodes with your family and friends, or at least leave a review on iTunes or Stitcher. The content and opinions expressed are those of the host and presenters. They are not intended to diagnose, treat, cure, or prevent disease. Product statements have not been evaluated by the FDA.